I'm very happy to be here. This is quite an honor for Voices for a Healthy Southcoast, and we're here to honor them this morning in this beautiful, magnificent room, and they deserve all the credit. We are quite a team and work really hard to get where we're going, so congratulations to Voices for a Healthy Southcoast.
Here and watch all of you enjoy yourselves this morning. Welcome. My name is Kerry Unen. I'm the board president with MPHA. At the federal level, the Prevention and Public Health Fund has been cut by $5 billion, not million, not thousand, $billion, and is under continued attack, putting in danger millions of dollars of public health funding in Massachusetts. But we have a solution. It's called MPHA. It is during these difficult times that MPHA shines. Thanks to the leadership of MPHA and many of you who are here right now, we have several public health bright spots to celebrate in Massachusetts. The state is implementing important school nutrition standards that MPHA helped to pass as we work together to ensure the health of our children and the future of the state. Even with the distraction of bake salegate this past week, the standards as a whole are among the strongest in the nation and are an accomplishment we should all be proud of. Another bright spot to celebrate, and in historic news, as we sit here right now, payment reform proposals from both House and Senate included an MPHA initiative to create the Prevention and Wellness Fund to support community-based programs that make schools and neighborhoods healthier. I'd say this is more than a bright spot. It's a supernova. This is a pioneering initiative that puts Massachusetts on the national map again for health. Thanks to MPHA and our coalition partners for making this happen. Our board and the organization are stronger than ever. We are ready to build on our successes and take it to the next level. I'm truly proud to lead the board of such tough, smart, and effective organization. So let's honor the great work of tough, smart, effective, and pioneering leaders who are having a significant health impact through thinking and acting out of the box. Before we proceed to the more fun part and formal part of the presentation of today's event, I do want to take a moment to do a few thank yous. First and foremost, I want to thank the staff for all the hard work that they have been doing over the past years and for the hard work that they're currently doing in terms of all the high activity happening in the policy world and also the work moving forward. I want to thank the board and I want to thank all the volunteers. I also want to thank, yes, definitely, thank you. I also want to thank our awardees for their leadership in public health. I also want to thank our key sponsors, that's Partners Healthcare, Bay State Health, Health New England, Blue Cross Blue Shield of Massachusetts, Children's Hospital Boston, my past employer, and Apt Associates. We also want to thank our sustaining foundation supporter, the Boston Foundation. Furthermore, you should stay tuned for the chance drawing that we're going to have later in the morning for various prizes that we have. We want to thank Roger Berkowitz, MFS Investment Management, the Moolah's Market Basket, and Wegmans Supermarkets for the prizes that they have donated for the chance drawing. So stay tuned for that one. So with this, I want to move forward and introduce our State Secretary of Health and Human Services, Dr. Judyann Bigby.
Good morning, everyone.
Morning.
Karen, it's so wonderful to see you here as president of the board. Karen has been such a long-time supporter and leader of public health, so it's wonderful to see you in that role, and thank you for introducing me. I had hoped that I would get here a little bit earlier today. How many people have elderly parents that they're concerned about? My mother moved to California 10 days ago, and already my sister is failing at her new role of being the primary caretaker. So I've been on the phone since 5 o'clock this morning, but my mother's okay. I want to acknowledge our great Commissioner of Public Health, John Auerbach. The governor often refers to John as the best state health commissioner in the nation, and I'm certainly endorsing that label. John has been just a wonderful advocate for public health and is really doing such a great job leading us. Thank you, John. Judy Palfrey, who I've known for many, many, many years, who I have this allegiance with, because as physicians trying to lead medical care institutions to do more to promote health, I know the challenges she faced, and she's so deserving of the Paul Revere Award, so congratulations. And thank you for the work you're doing now with the President and the First Lady to promote children's health. I always appreciate being at this event because it is such a reaffirmation of the importance of public health, and unfortunately it also reminds us of the challenges that we face promoting the public's health. Karen, I hadn't heard the phrase bake sale gate before, but that was quite a phenomenal issue there. The Massachusetts Public Health Association has been a stalwart advocate and leader for public health, even as we continue to focus on healthcare reform from often a pretty narrow definition of what that reform is. So I want to thank the Massachusetts Public Health Association for your leadership and constant reminder that health and wellness needs to be on the agenda that we're looking at as we promote access to health care and healthy communities for people in the Commonwealth. I think you all know that Massachusetts is in very many ways a leader. Karen referred to this. In the nation, we are number one with our 98% coverage of the population. Yeah, we should keep applauding ourselves for that. We also have 99.8% of children covered. I often think I could count on two hands the number of kids who need insurance, but we do want to get to 100%, so we have work to do. I also want to recognize that as we're debating this healthcare payment reform or healthcare cost containment approach, that one of the reasons we're here and can say that we have near universal coverage is because of the partnership that we've had with providers, employers, businesses, government, and consumers to really keep moving and try to accomplish that. And we need to keep going in that direction. We know that there is an impact of having universal access as well. More than 90% of people in Massachusetts say that they have a primary care physician, and they actually go and get care, including preventive services, and we know since healthcare reform has passed and been implemented that more people are getting preventive services. More businesses offer insurance today than they did before reform, so all of the fears that we would crowd out private insurance has not come true. We also know that in spite of the fact that Massachusetts is a relatively healthy state, we are getting healthier, and I think we can attribute some of that to improving access to care. More people are getting preventive services, more cancer screenings, more women are getting prenatal care when they're supposed to get it, and we do see trends in emergency department usage decreasing. We also can be proud of the initiatives that we've done in Massachusetts that demonstrate that public health, prevention, and wellness initiatives can have an immediate impact on people's health. It doesn't take 10 years to see the effect. 150,000 people stopped smoking once we expanded coverage for smoking cessation programs. And we know that that had a direct impact on the number of people going to emergency departments with chest pain and with asthma attacks, and that we saved hundreds of thousands of dollars that way. I also want to emphasize that as we think about where the challenges are, that it's women, minorities, and low-income people who experience the biggest gains in access to health care through reform. We all know, as Karen mentioned, that expanding coverage was just the first step that we have to take. And as the rest of the nation has looked to us, and President Obama crafted the Affordable Care Act after the Massachusetts plan, we now need to focus on how do we sustain this coverage by making sure that we do everything we can to control costs, not simply for the goal of bringing down spending in healthcare, but because it's crowding out other things that we all know are important for the public's health: education, looking at environmental issues, building healthy communities, making sure that our infrastructure doesn't fall apart. So we are very excited about how now the legislature, after Governor Patrick has been asking for more than a year, is beginning to act. And we look forward to partnering with him to get a great bill in Massachusetts that will allow us to make sure that our cost containment strategies are based not simply on cutting spending, but by improving the healthcare system, improving quality, and getting better outcomes. We want to make sure that we have integrated systems of care, that we do more to promote wellness and health, and at the end we want to show that our quality and health status has improved. So I really want to again thank MPHA for their leadership and making sure that we continue to pay attention to these issues. I want to thank all of you because I know that you are great advocates for Massachusetts being a leader in many, many ways in promoting the health and wellness of people. And thank you for the time to be here this morning.
Secretary Bigby, thank you very much for those wonderful words. In fact, my mom is flying in tonight. So my husband Howard and I, it's our week of spending time with my mom. I may give you a call if I need help. So again, thank you very much. Now, let's move to the first awardee presentation. And I want to bring up Ellen Parker, who's going to be doing the presentation to the Corporate Citizenships Public Health Award. Ellen Parker is the Executive Director of Project Bread, the state's leading anti-hunger organization. And Project Bread, under Ellen's leadership, is one of the first anti-hunger groups to understand that hunger and food insecurity are public health issues and need to be addressed on a community-wide and systems basis. She's also a recipient of one of our awards last year, so welcome.
Good morning. Lovely to hear Secretary Bigby. I don't know if she's still here. I don't have my distance glasses on, so I can't say. So I am really, really, really honored to be the person to present the Corporate Citizenship in Public Health Award to a wonderful, probably the most wonderful business in Boston, City Fresh Foods. So if you don't know much about City Fresh Foods, let me tell you a little bit about it. It was founded in 1994 by two brothers, Glenn and Sheldon Lloyd. It started as a takeout lunch place and has really dramatically expanded. They provide meals to charter schools, they provide meals at camp, they provide meals to elderly. All in all, 11,000 meals every day. I had to circle that, Glenn. And it's just very, very impressive. And it would be enough to have this great business that was giving kids good food. But City Fresh is really a lot more than that. And I came to understand that over the past few years because Glenn, Lloyd, and I have worked very closely together on some issues related to school food. And Glenn is one of the good guys, and they're easy to find because there's not that many of them. And Glenn was right there from the beginning with me, talking on the phone, strategizing. And I think through our relationship, and he started to provide some meals in East Boston to some of our elementary schools, I really began to understand what it meant not only to make sure that kids had good food and make that investment, but also to invest in the community and really invest in the wealth of a neighborhood and the way that that raises people up in the same way that having something really good to eat does. And so I've never really been much of a capitalist, but Glenn has turned me around because he's a good capitalist, and he brings wealth into the community, and he cares about the kids, and he walks around and he tastes the meals with the kids, and he's really one of my heroes. He's really a great guy. I call him for advice all the time, and I think he is so well deserving of this Corporate Citizenship Award in Public Health for City Fresh Foods. Glenn Lloyd.
So first let me say, on behalf of my hard-working staff, I humbly accept this award, and I want to thank Mass Public Health Association for considering City Fresh Foods as this year's Corporate Public Health Citizen. Those in the audience who run or direct their own organizations know it's the people, it's the team of folks who vision with you, but who come in every day and work side by side with you to do the hard work, are the real heroes. So I want to thank the team that's here today at the table at City Fresh Foods. Thank you, Edie and Phil, and I think Lewis is in the room, and Nadine, but also representing our 80 folks back at the shop who are doing the hard work getting the meals out this morning. In the little time that I have, I don't want to take up time talking about the doom and the gloom of our not-so-healthy health indicators, not only in my community, in which I reside and work in Roxbury, but also the greater communities, in the suburban communities, in the rural communities. If you haven't heard, we have an epidemic. We have a health crisis epidemic. I think it was last week the CDC just came out with the numbers that they're predicting in 2030, 42% of all Americans obese, 11% of that severely obese. But instead of all that, this morning I prefer to be cautiously hopeful, because there seems to be a shift in thinking. More and more people in and outside of the health profession are realizing that in terms of creating healthy bodies, which lead to healthy minds, it's really about the type of food that we put into our bodies. And it's really not that complex, right? It's lower sodium, less refined sugar, less meat. It's more fruits and vegetables, whole grains. And when we do this in controlled groups, clinical studies now are showing amazing results. So as a local prepared provider, meal provider in the Boston area, and especially one who services populations who have less choice in some ways, and sometimes little choice at all, we at City Fresh Foods have an awesome responsibility to feed our kids and seniors the freshest and the healthiest and tastiest meals within the constraints of our industry, which there are a few constraints. We have cost constraints, we have logistical constraints, and gladly we have fast-changing archaic regulations and with the new health regulations coming out, which are a lot better than what we've had to deal with over the last years. Having a healthy meal option is one component of this equation. The other one is, I think, a more challenging one, is that's changing behavior. And, I've actually been able to witness this in action where I've been in a school, one of our schools actually up in Lawrence, and the teachers, before each meal, they spend 5 minutes going over what the meal is, and they tell the kids why it's important to eat the different healthy components of the meal. And you know what? It works. When you do that, the kids eat the food. And the other day, I was in a larger charter school here in Boston, and I happened to be in the day where we're doing I love to talk about our salad meal, and it was our little kindergartners, and these adorable kids, and walking around the room, basically I'm telling them, you got to eat that tomato, you got to eat that cucumber. You know what? They did. And this is the stuff that is, it's limited resources, but this is the other battle, the other front. It's the educational front, it's the cultural front. It's how do we get these folks understanding, our kids understanding that it's important to eat this food. And unfortunately, there's limited resources for those things, but that's how we all can work together, I think. And another part of a healthy approach is we take a holistic approach to the community, as Ellen mentioned, and that's by employing folks. So every year we're able to recycle millions of dollars back into the community, into our residents' pockets, which helps relieve some of the economic stress of some of our local urban residents. And unfortunately, we're just scratching the surface on this one. But I think Karen mentioned the fact of thinking bold and out of the box, and I think that's what it's about as we look at how to create healthier communities. And one in particular out-of-the-box thinking is this thing called urban agriculture. If I could just take 1 minute on urban agriculture. Because in Roxbury and Dorchester, Mattapan, we actually have thousands of acres of vacant land. It's been sitting for decades. And guess what? It's going to sit for decades to come. And we said, listen, can we turn this land into productive land? We have idle hands, and we actually have a marketplace for fresh local crop. And so City Fresh Foods has acted as a platform to help create this program called City Growers. And guess what? We're going to figure out how to grow for market on these small plots of land. And this is what crazy entrepreneurs do. They think of crazy things, and they try to make them happen. But guess what today, this morning, I actually have to bring this company. This is actually grown off of Blue Hill Avenue in beautiful compost soil, and we cut it and we're selling it to the marketplace. So I want to end with this, that really it's about, it's a collective effort. And it takes practitioners like City Fresh Foods and other great practitioners in Boston. It's the healthcare professionals in the room, politicians, it's community leaders. We're going up against serious forces to really change people's habits and eating habits, and forces that are backed by a lot of resources. And so it's going to be all of us coming together to make this thing happen. And I'm looking forward to working with folks in this room so that we win this battle. Thank you.
And Lynn doesn't notice, but can I get that bag of lettuce back? Because we're going to auction it off. It looks delicious. No, seriously. $50. Anybody else out here? I'm starting. $50. Thank you. Anybody else? Come on. Jody? Gotcha. Thank you, Linda. On to the next awardee, and it is, as it was last year, my absolute pleasure to introduce our great public health leader and previous winner of MPHA's Paul Revere Award, the Massachusetts Department of Public Health Commissioner, John Auerbach. It is Commissioner Auerbach's vision of Massachusetts local communities leading the way for prevention that resulted in the Mass in Motion and Community Transformation Grant Network. So it is very appropriate that he presents our Community Leadership Award this morning. Thank you.
I want to start by, before presenting the award, just to take a minute to thank the Massachusetts Public Health Association for your leadership. Karen was mentioning earlier that this incredible victory that has occurred in the just yesterday's vote by the Senate on the payment reform bill to create a public health and prevention trust with $20 million in it a year. With the idea that that would go and support community-based initiatives throughout the state that would be doing efforts demonstrating you can save money on in providing health care just if you keep people healthy by doing really innovative and worthwhile programs. You know where the idea for that trust came from? The Mass Public Health Association. It was, I'm sure that Karen was probably sitting in a room with Valerie Bassett and they said, well, what can we propose? And at the time it was proposed, it was like a new idea, and I think a lot of people probably thought, oh, forget it, we'll never come up with that kind of support. And they built the support legislator by legislator so that it passed with this incredible vote yesterday. So I think that's one indication of the importance of the Mass Public Health Association and its leadership. And its other work this year around Act Fresh, I think, has just made an enormous difference in terms of changing policy, helping legislators think about new innovative policies and approaches. So we're so lucky to have your leadership, Karen, and Maddie's leadership, Valerie Bassett's leadership, and the board of MPHA. So just on behalf of the Department of Public Health, I want to say thank you, thank you, thank you for the great work that you've done. In presenting this award, I was thinking back like maybe 10 years ago to when some of the work around overweight and obesity was kind of just getting going. We were thinking about what was going to make a difference in terms of the rising levels of overweight and obesity. And, I was thinking back at that time, I think mainly when people talked about what was going to make a difference, there was this real focus on individual behaviors and just telling people that they had to eat better or exercise more. And when they were also thinking about who's going to be doing work on this issue, people thought, I think, oh, it's just going to be the wealthy suburbs. The cities, the urban cities outside of Boston, they're not going to work on these issues. And so fast forward 10 years, and I think the awardee this year really represents just how much progress has been made in understanding what we need to do around addressing the issue of overweight and obesity and the related chronic diseases. In that now, clearly people say that the real issue that we need to address is changing the conditions in people's lives, not putting the responsibility mainly on the backs of individuals, but saying it's policies that have made the difference in terms of the growth of the population that's overweight. If we change the policies in people's lives so that the healthier behavior is the easier behavior, we'll see real change. And also, we've seen where has the innovation come from? Where has the leadership come from? And what we've seen is it's not come just from some of the wealthier suburbs. They've done some good work. But if we look at really inventive work that's transformed the conditions in people's lives, we see that leadership has come from the communities that we're honoring with the Community Leadership Award this morning. And that is the Voices for a Healthy Southcoast. The Voices for Healthy Southcoast is a coalition, and their leadership and commitment to prevention and health has been extraordinary. They are bringing together a wide and diverse set of organizations and communities to work specifically on the issue of prevention and public health and on doing what I was mentioning earlier, and that is changing the conditions in people's lives so that it's just easier and more natural for the healthier behavior to be the one that people practice. They mobilized, included in the coalition were they mobilized local elected leaders. They mobilized the state and local public health departments. They got business leaders involved. They got youth involved. They got community organizations involved, schools, recreation departments, hospitals, all in a strong coalition agreeing to work in a wide variety of different ways to change policies and to change the environment. We're delighted that they've been critical partners in our Mass in Motion efforts, and they've really shown just what can be done by the examples, for example, in Fall River and New Bedford. They were among the earliest and the most successful Mass in Motion communities, and they've consistently engaged in their communities in lots of different efforts, and they were among the strongest supporters of MPHA's Act Fresh initiative. So here's some examples of the changes that have resulted due to their work. They've focused a lot on physical activity, so they've worked with local schools in the area to help to reinstate recess as part of the normal school day. They've encouraged and worked with to help the schools to develop meaningful and actionable wellness plans to make sure that kids are eating healthy foods and exercising as part of the school day. Part of that has also been promoting healthy school lunch programs and having healthy foods on the table at the schools. I think incredibly, Fall River, New Bedford, and Wareham, part of the Voices, have banned the sale of tobacco in pharmacies. So a real example, I think, for the rest of the state by saying no pharmacy in those communities are now allowed to sell tobacco products. They are working to change the foods that are allowed to be served in municipal settings and vending machines. They're working to create a bikeway that would connect Providence, Rhode Island to Provincetown, where they play a critical role in terms of the connecting routes. So they also are doing extraordinary work in terms of demonstrating that you can have strong linkages between the community partners and the clinical partners, and they're working with, among the different partners in Southcoast are the Southcoast Hospitals Group, but it's also the YMCA, the local community health center, the Healthy City of Fall River, Healthy City Partners for Healthy Communities, the Mass in Motion New Bedford, Immigrant Assistance Center, Mattapoisett Health Department, National Health Service, New Bedford Office of Planning, Seven Hills, UMass, Dartmouth, etc., just to give you some sense of the breadth and inclusion of these efforts. So, for their effective teamwork as a regional partnership, for their concrete accomplishments to build health and prevention into the fabric of their regions, and for their relentless pursuit of the vision of Southcoast where everyone is surrounded by opportunities to be healthy. It's my great pleasure to award the Voices for Healthy Southcoast, the MPHA Community Leadership Award this year. Voices is Nancy Linnell of the YMCA and Donna Quirum from the Southcoast Hospital Systems. They're the co-chairs of Voices.
So we want to thank MPHA for this award, and the commissioner really said it all, so we'll be really brief to get us maybe back on time schedule. But I'm Nancy Linnell. My day job is the COO, Chief Operations Officer for YMCA Southcoast. And we received, it's in the book, your program this morning, an Achieve grant from the Center of Disease Control and Y of the USA. And there's several other Achieve communities in Massachusetts and working in healthy communities. I've been a YMCA professional for 33 years. Yes, I started when I was really young. Thank you. Thanks for that. To date, this has been really the most exciting part of my job. I've worked in aquatics and fitness and childcare and camp, but never had ventured really out in the community to gather community partners to work on such lofty goals that we're working on. So we've only been together 3 years, so not bad for 3 years. And we know we have a long way to go. We're continuing now. We received a cancer prevention grant, working in the same avenues. But the biggest thing for me was putting the team together, and the first thing I had to do as part of the grant process was to find the like community partner. And it was obvious that with our Y service area being from, as the commissioner said, from Wareham, from the canal over to Rhode Island, Southcoast Hospital stepped up to the plate. And Donna, we had met. 3 years ago we met, and we've become great friends and colleagues and working together. Southcoast Hospital has been an incredible partner, and as the commissioner said, I'll just say quickly who's here today: Dave Weed from Healthy City Fall River and Partners, Kerry also from the hospital. You guys should stand up. Our community benefits, and hold the applause for them. Pauline Hamel is Dr. Pauline Hamel is our Mass in Motion coordinator for New Bedford. Amanda is our nutritionist from the hospital. Martha is from the Greater New Bedford Community Health Center, and representing SERPED today is Jackie. SERPED is the Southeast Regional Planning, and they're working on our bike and transportation plans. And I'll let Donna say just a few quick words.
I just also want to say thank you for the award. We're very grateful to get it and to be recognized. The group that I work with is incredible, Nancy and everyone sitting at the table. There are a few people who aren't here, like Marsha Picard, who always would tell us that we all play nice together. And in doing that, that's why I think we've accomplished so many of our goals that we have accomplished. Southcoast is a very big region. It's very, there are different ethnics, there are different cultures, and we've been able to work with everyone to hopefully bring more health into our communities. So once again, thank you so very much. We really, really appreciate the support. Thank you.
Thank you. Such exciting stories. So we're going to take a bit of a break. This gives you a chance to fill up your coffee cups, get more food, get something else, some more juice, and we'll resume at 9 o'clock for the last part of our morning. So take a few minutes. Thank you. I'm going to ask Maddie, Ribble, and Steve Chestakowski to come up so that we can continue with our program. We're eager to get you out on time.
Good morning, everyone. My name is Maddie Ribble, and I serve as the Director of Policy and Communications at MPHA. And my task this morning is to tell you just a bit about some of the accomplishments that MPHA has had since we gathered here last year for the 2011 Awards Breakfast. And to do this, I'm joined by a friend and mentor of mine, and MPHA board member, Steve Chestakowski, Executive Director of Tobacco Free Mass. Since we gathered here in this room last year, MPHA, working together with many of you, maybe most of you, as I look around this room, has been fighting hard for prevention with campaigns that leverage stronger coalitions than ever before, new and deeper partnerships in every corner of the Commonwealth, and a growing cadre of legislative champions. We've talked a little bit already this morning about our campaign to embed prevention in the state's payment reform effort that has been successful to now. And this is because we've engaged hundreds of civic leaders in this effort, mayors and town managers, healthcare leaders, business, philanthropic, and labor leaders, and more. Dozens of legislators who have gotten involved. This has been a true team effort of hundreds and hundreds of people to make this happen, and led by a dedicated coalition that's brought together vision, policy expertise, and grassroots reach together in one place. This is why you saw both the House and the Senate include Prevention Trust Fund in their bills, and why last night at 8:30 the Senate took a vote to include $20 million per year in that trust. on prevention and this funding, and certainly this amount of funding, was not part of the conversation about this issue a year ago, and it is now. It was something that many people said we can't achieve in the political and fiscal environment that we're in, but we did with your help. But this is just one part of what MPHA has been doing since last year. In our ongoing work to combat chronic disease, our Act Fresh campaign has been active every day of the week, every month of the year. Among just some of the campaign's accomplishments, we've mobilized the public health community around zoning reform to improve our state land use laws so that they don't impede healthy community design, and in fact they promote healthy community design so we get to those strong health outcomes that we need. The campaign has served as a convening partner of the Grocery Access Task Force, working with public health, food industry, and economic development officials to put together an action plan to improve access to healthy, affordable food, which we know is limited in far too many of our communities, both urban and rural. And we led the advocacy efforts last summer to assure that the new school nutrition regulations through the Public Health Council would deliver on the promise of the school nutrition law that we worked together for so many years to pass. But we didn't want to just see regs on the books. So as soon as we finished working with the commissioner and his team at DPH, we brought together an implementation working group of principals and superintendents, school committee members, PTO representatives, school nutrition directors, school nurses, and the list goes on, to identify action steps to turn those regulations and that piece of paper into a reality. And those regulations will go into effect this August 1st and impact 1 million Massachusetts school children. The controversy over bake sales in the last couple of weeks has been disappointing and I think a bit distracting. But we have to make sure that we don't allow it to take our eyes off the prize, which is progress to support healthier schools and healthier kids this year and next year and the year after, and we're winning that battle together day by day. Lastly, MPHA has been working successfully to safeguard and increase funding for Department of Public Health programs that are too often under the gun in our budget deliberations at the state level. Programs we depend on every day, like environmental health, food protection, WIC, vital records, health promotion, and others. These three examples, prevention funding and health reform, the Act Fresh campaign, and the successful budget advocacy, are just some of what we're most proud of in the last year. This morning we're pausing to reflect and to celebrate our leaders in public health. But this afternoon, we at MPHA and all of you need to get back to work, because we have a lot still to do. We thank you so much for your partnership on these efforts.
Good morning, everyone, and I'm really pleased to be here today. I'm one of the newest members of the MPHA board, but this is an organization that's not new to me. I've been working with MPHA on a variety of campaigns going back 15 years, and I'm very, very proud to be a member of the board. You know, MPHA to me, if you remember that children's book, The Little Engine That Could, this is MPHA. This is an organization that has a small budget and it has a small staff and it takes on really, really big tasks and it succeeds. It does the job. It does the job so well. You've heard it all today. You've heard it from the commissioner. You heard it from the secretary. You know what we've accomplished here at MPHA. Getting the school nutrition bill alone took a decade. Then the regulations, then the implementation of the regulations. The work that you've heard about the Act Fresh campaign and involving the public health community in that campaign, the work around zoning, the work around the wellness and prevention trust that we're talking about today, the behind-the-scenes work for those programs at the Department of Public Health that really don't necessarily have an active constituency other than MPHA. MPHA has been there to fight for all of these good causes. We would not be here in terms of the public health successes we have had in the state without MPHA. So, I've got two things to do here. The first is to, in effect, doff my cap to MPHA for all that it's done. And secondly, yes, I'm the board member who now has to pass the cap and pass the hat around and ask you for your continued support, because without the active membership of MPHA, without your participation in what we do, and yes, without your financial support, none of this would be possible. We need to continue to go forward. We need your help. And to continue to make this, this request a little more eloquently, I'm going to invite up here someone who I think you all know, Harold Cox. Harold is a past board president of MPHA. He is a past winner of our esteemed Revere Award. He's the associate dean of the BU School of Public Health. Thank you, Harold.
Good morning, everyone. I'm Harold Cox. This is the audience participation part of the program. So the first thing that I want you to do is to grab the envelope that's on your table, and I want you to let me know that you have it by shaking your heads. And nobody moves. But you have to hold these envelopes. This is actually the easiest part of the program, and it's the easiest part of the program because my job is to ask you for money, and your job is to give the money. That's really easy. And it's easy because of all the things that Maddie and Steve have just said to us. We all of us know about the importance of public health. Everybody here also understands the struggles of public health. And we are all familiar with the incredible work of the Massachusetts Public Health Association. So, I need you to give today because you know it's the right thing to do. I need you to give today because you are impressed with the work. I need you to give today because you want to continue the work. I want you to give today because Harold Cox is guilting the hell out of you. And if none of that is enough, I have one more reason for you to give. And that is, you will be eligible to participate in the drawing. Now, you can't participate in this drawing unless you give. And let me tell you what you will be eligible to receive if you give.
Thank you, Harold, and thank you to all of you who provided support here this morning, support by being here, and especially financial support. And at any point during the day and on your way out, if you still haven't handed in an envelope, any member of the staff would be more than willing to accept it from you. Now we return back to our program.
I'm back up here really with the best part of the morning, handing out the MPHA's Paul Revere Award. I'm extremely delighted to be the one to give the award to Judy Palfrey, Dr. Judy Palfrey. I worked with Judy Palfrey at Children's Hospital, learned a boatload from her and continue to learn a boatload from her. And in fact, Judy, on the internet, sorry, it happens on the internet, I found a PowerPoint by you in Spanish for your work in Chile. I loved it. We're going to have to send that to Joe Carrillo. So anyway, and in all honesty, I am delighted to be here to present the Paul Revere Award this morning, which is a very special award recognizing a career of accomplishments that contribute to and expand the field of public health. This year, as I just mentioned, we are honoring Dr. Judy Palfrey for her groundbreaking leadership in linking community health to pediatrics. Dr. Palfrey is the T. Barry Brazelton Professor of Pediatrics at Harvard Medical School and a Senior Associate in Medicine at Children's Hospital, Boston. Yes, feel free to ignore me and enjoy it. In her years of work with children, both nationally and internationally, Dr. Palfrey has been especially dedicated to those with special health care needs and those from traditionally underserved communities, and as such has tirelessly attended and continues to tirelessly attend to the needs of the most vulnerable. Currently, Dr. Palfrey is the director of the Global Pediatrics Program at Children's Hospital of Boston and is working to bridge the gap in healthcare for children in developing nations. She is dedicated to establishing training and service programs in international sites based on her experiences in the United States. We in public health want to recognize Dr. Palfrey's appreciation for how the environment a child lives in has a profound effect on his or her health. In fact, my very first job with Judy was part of the Dyson Initiative, and it was my introduction to connecting the community work with the health of a child, where we were looking at the health of a child beyond the biology and how the community was affecting the health of the child. And so that was fabulous work that we had done together. And Judy, thank you for that experience. Another fabulous example that Judy's currently working on is following a community-based child health and development model that Judy worked on, known as Brookline Early Education Program, BEEP. I should say Dr. Palfrey, I'm sorry, I just know. She's now seeking to roll the same model out in Chile, Un Bien Comienza. Did I do it right? A good start in Spanish. The program model provides health and developmental services for children and their families from 3 months before birth until entry into kindergarten in an effort to ensure that children are healthy and ready to learn. BEEP demonstrated positive outcomes for children enrolled in the program, and I have absolutely no doubt that the Un Buen Comienza program will make a difference for the children and families in Chile under Dr. Palfrey's leadership. In addition to her professional accomplishments, she's appreciated as a teacher and mentor, certainly in my life, to generations of Harvard students, which I wasn't, BU, and for those of us like me who have worked with Judy and known her, value her fierce integrity and dedication as well as humility. It is my personal and professional pleasure, see I'm nervous, to present the 2012 MPHA Paul Revere Award to Dr. Judy Palfrey.
Raise the windows because the Old North Church is just out there. A hurry of hoofs in a village street, a shape in the moonlight, a bulk in the dark, and beneath from the pebbles, in passing, a spark. Struck out by a steed flying fearless and fleet, that was all. And yet, through the gloom and the blight, the fate of a nation was riding that night, and the spark struck out by that steed in his flight kindled the land into flame with its heat. How many of you had to say that as a third grader? I was trying to figure out how the Paul Revere Award had come to be, and I didn't find out, but it's such an honor to be here. And Karen, I can't thank you enough for all that you've done for the state, for the nation through the Dyson program, and everything that you do. I know Debbie Walker was going to be here. I think she's off, but I want to thank the board so much for this honor. It's just an amazing thing to be standing here. I particularly want to thank my husband Sean, who's run off to try to get the immunization bill further along and to see some patients. We're celebrating that also these days. And I particularly want to remember my major mentor, Julie Richmond. And Karen just mentioned the work that I'm doing now, taking the BEEP model and the Head Start model to Chile, and hopefully actually to other countries in the world. And the reason is that when I sort of took my blinders off, I'd always done domestic work, and I took my blinders off and said, I'm going to do global work. I went to see Julie, and I said, Julie, what should I do? And he said, well, there are 3 things that you should do. This is typical Julie fashion. He said, number 1, somebody needs to take care of children with AIDS. Number 2, we've got to take care of orphans. And number 3, spread Head Start throughout the world. And so I've taken that quite seriously to move on. But I want to tell you, I am so proud to be a Massachusetts citizen. And I'm so proud to be here and grateful and thank you for all the work that you all do, because it's the work of this great organization that's protected our pregnant women, our children, our people with disabilities. It's gotten the health care access. It's going to get these immunizations. And I just want to tell one little story. You know, your life is really long. There's a lot of stories. I was trying to think of one that I think typified what we do here in Massachusetts and what our public health community can do. And that's the story of the Sydney Borum Health Clinic. How many people here have been to, seen, visited the Sydney Borum Health Clinic? Well, you know, the interesting thing is, if we were talking about this 10 or 15 years ago, probably everybody would have that, know that. But this was during the HIV epidemic, and as a city, as a state, we all really did get together. And the interesting thing about the Sydney Borum Clinic was that one day the Commissioner of Health called all of the businesses and the hospitals and everybody into his office. And he was very much like you, Harold. He wouldn't let them out until they established the Sydney Borum Clinic in honor of Sydney, who was absolutely a member of our community. He was a man from the public schools. He was a man who took the promise that he had the terrible disease of HIV, but he was going to make sure that no public school student in Boston graduated without understanding about HIV. And so when he died, the clinic was raised by this collective effort. Now I mention this because First Lady now has as the goal for our obesity epidemic to take this terrible epidemic that's gone up and bring it down in a U shape. And if you look at the HIV infection rates for babies, what does it look like? It's 0, and it's a U-shaped curve, just like that. Went up like a rocket, plateaued, and now is 0. So in the public health community, we can do these things, and we can do them when government, business, academia, and public health work together, because there's so many social determinants of our health, and when we recognize that it's all of us that accomplish these kinds of things, we're going to get, not only did we get the HIV done, and I'm so happy to see Darrell here, Kevin Cranston was here before, I mean, all the memories, but having that model for us is so important. So thank you very, very much for this wonderful award. We're so close here in Massachusetts, and I started with that little idea about the spark, because it's important to have these sparks to keep us working together, to keep everything going forward and bright. And I think I can turn this around to saying that spark might set off Karen's supernova. Thank you so much.
Good morning. I'm Monica Escobar Lowell, and I'm a member of the board of the Massachusetts Public Health Association, and thank you very much for coming here today. And Harold, we're doing the fun stuff, so go ahead. This is my colleague.
Jody Silverman, also on the board of MPHA and co-chair of the development committee with Monica. First of all,
Before we go into the fun part, which is the raising of the money, and after these presentations, how can you not want to pay $75, as I am, for a bag of lettuce? It's going to most important cause. I have a 3-year-old daughter. She'll consume this, hopefully. I do want to acknowledge Market Basket, who's here in person, for their contributions and for their support of MPHA before we get started. Before we draw the winners, there's one more opportunity to pull out your proverbial checkbooks, even if they are in absentia, and support the work of MPHA. You've heard this morning in a very quick time the breadth and depth of the work that is done by a very small group of people behind the Wizard of Oz curtain, if you will. But it would not be possible without the support of everyone, and yes, financial support is key. So before we give out those fabulous Red Sox tickets, and other wonderful prizes, everybody, one more chance to get out those checkbooks, as I said. And I'm even happy, I will pay my $75. I'm even happy to put this back in the kitty if somebody wants. I mean, fresh, right off the garden, bag of lettuce. There, right here, thank you.
The first set of, for the raffle, what we're going to do is a $50 gift certificate for Market Basket, donated by the Bulisma. So, Allison Martin from Nashville, Tennessee. Please come down from the Harvard School of Public Health. Where are you? 4 tickets and parking pass. Imagine that. Red Sox versus the Yankees, Sunday night, July 8th. Seats in the State Street Pavilion, and this is donated by Roger Berkowitz and Legal Seafoods. All right. And the winner is Jacqueline Schmidt from SRP.